Hello, and welcome to USA Today's The Excerpt. I'm Dana Taylor. For Robert F. Kennedy Jr., it was never going to be a smooth road as Secretary of Health and Human Services, given the controversy surrounding his well-documented vaccine hesitancy. But his stewardship of the agency is now at a crisis point, as the nearly 80-year-old CDC, or Centers for Disease Control and Prevention, reels from a series of worrying red flags. Is this cornerstone agency created to safekeep American public health crumbling? Here to help me dig into all of this is USA Today White House correspondent Swapna Venugopal. Swapna, thanks for joining me.
Thank you for having me, Dana.
Let's start with the heated Senate Finance Committee hearing that took place this past Thursday. Senators grilled Health Secretary Robert F. Kennedy Jr. over what some are calling his politicization of vaccine policy and his past promises not to interfere in scientific decisions. What happened?
Robert F. Kennedy Jr. was a very controversial figure, even at the very start of this administration. When he was being confirmed, there were a lot of misgivings from the scientific community because of a lot of the controversial theories that he had peddled in the past. So now there's big alarm bells going off. It's because the CDC is going through a gigantic mess, is what many people describe it as, major turmoil, really. And it's because he, first of all, cut staffing, and he made tons of cuts in staffing and funding, got rid of many programs. He also then fired the CDC head, Susan Monares. And right after that, three high-ranking officials also resigned. And the reason for that was because they were having some, back and forth about vaccine policy. And that's highly alarming to the scientific community, especially because he had promised initially that he wouldn't do anything to change policy on vaccines. And so that was a highly concerning thing for many because, it has caused so much confusion among people. Vaccines would only be recommending vaccines for people over the age of 65 or people with some pre-existing condition. And that's a major departure from what the policy used to be, which was anyone over the age of 6 months old was recommended, to have a vaccine. Now, with all of this, what it also means is that many of the pharmacies would not be carrying this based on the CDC recommendation. Many of the insurance companies would probably stop paying for this because it's not recommended by the CDC. So there is also a question of access. And all this was very evident during the Thursday hearing when Senator Brasso said to Kennedy that the changes he's made and all these policies regarding vaccines that he's making are deeply concerning.
So over the last 50 years, vaccines are estimated to have saved 154 million lives worldwide. I support vaccines. I'm a doctor. Vaccines work. Secretary Kennedy, in your confirmation hearings, you promised to uphold the highest standards for vaccines. Since then, I've grown deeply concerned. The public has seen measles outbreaks, leadership in the National Institute of Health questioning the use of mRNA vaccines, the recently confirmed director of Centers for Disease Control and Prevention fired. Americans don't know who to rely on.
Swapna, let's talk about the firing of CDC Director Susan Monares. Some highlights of the reaction to that include last Sunday's op-ed in the New York Times signed by 9 former CDC directors, followed by last Wednesday's public letter signed by over 1,000 current and former CDC employees calling for RFK Jr.'s resignation. What's the fallout here?
So last week in the New York Times op-ed, Susan Monares basically said that Kennedy had pressured her to pre-approve any guidance that comes from this new advisory panel that he has, created. And it includes a lot of anti-vaccine activists in that. And so that was a big cause of concern for her. And so she decided, she had to step down. And as a result of that, several other high-ranking officials also stepped down and said it's a major red flag.
Recently, California, Oregon, and Washington have said they're forming an alliance to share, quote, credible information about vaccines in a response to turmoil at the CDC regarding vaccine guidance. Separately, the state of Florida weighed in with a push to kill vaccine mandates. Their state Surgeon General, Dr. Joseph Ladapo, calls them, quote, slavery. What's happening here?
So because of all this turmoil at the CDC and the vaccine recommendations, which have diverged a lot in the last, from the last 3 or 4 years, they've basically decided they're going to have their own consortium, their own alliance, and have their own recommendations for people in their states. This is a way of sidestepping the CDC recommendations and also perhaps a way to get insurance companies to cover these costs once, the states mandate them. So they could kind of, presumably force the insurance companies to cover this if they want to do business in their state. So that's kind of the power that the states have. Whereas Florida, they've gone completely the opposite way, where they've said they're not going to recommend any vaccinations. So that's their policy as of now.
We can't talk about the controversy at the CDC without talking about MAHA, the Make America Healthy Again movement. It's been mostly supportive of RFK Jr. What's the latest here, Swapna?
So the MAHA movement for now seems to be going strong. And this was a movement that aligned itself with President Trump's, Make America Great Again campaign. And they've been doing a lot of things in partnership. And so initially in the first few months, of course, he had a lot of success where, he was able to ban some 8 food dyes and things which won him a lot of praise from, MAHA mothers, as they call themselves. Many mothers highly excited about that, having these things out of the school cafeterias and things like that. Also from SNAP, lunches, they've taken out soda, or at least recommending that. He's also pushing states to ban, fluoride, which Florida has done, and many other states as well. So these are all things that seems to be general consensus, and not the fluoridation part, but broadly the food part is something that people are excited about. What they don't like is the fact that he hasn't done much about pesticides. And, even the MAHA report that's supposed to come out later this month, there's been a draft report that came out, which was leaked. And some of his biggest supporters are disappointed, reading the report, because they see that it doesn't say much about pesticides. And Kennedy was a huge proponent of banning certain pesticides, including glyphosate, and it's not mentioned at all, So they are disappointed in that. But otherwise, when it comes to food, they're all, they're highly excited. On vaccines, it seems to be divided. In his core MAHA base, there's a good percentage of whom like that idea, but the vast majority among Republicans and among Democrats, of course, they do not agree with RFK Jr. on his vaccine stance.
Last week, President Donald Trump also threw into question the COVID vaccine's efficacy, demanding that drug makers, quote, justify their success, end quote. Wasn't this part of their approval process to begin with? Why now?
President Trump has been extremely proud of Project Warp Speed. And so it was puzzling for many people to see his, Truth Social post, where he's questioning whether indeed it was, as successful as he had thought it was, or he had been told. The reason for that, some suspect, is because he's trying to create some kind of a distance between himself and RFK. So he doesn't want to be seen as someone who's against vaccines. So, and therefore he's just putting it on the companies, the pharma companies, to put out the data. Experts basically say that doesn't make too much sense, because pharma companies rarely put out data, for the people to see. Those are generally done. The efficacy is studied by experts, and they are reviewed in peer-reviewed journals. And it's not, public looking directly at raw data that the pharma companies put out. That's never the case. So it was puzzling for many people to see that Truth Social post and some believe it might be because he's trying to sort of have it both ways, appease the Maha base at the same time, not alienate the pharma companies or people, or even, discredit himself in the process because he was the one who launched Project Warp Speed.
RFK Jr. has also undermined confidence in vaccines in general by rescinding funding. What's happened here, Swapna?
RFK Jr. basically, a couple of months ago, rescinded some $500 million worth of contracts for mRNA vaccine development. And the reason for that is because some of his Maha base and some physicians that he trusts have said that it has been harmful to small kids. And he seems to believe that. He even said that on Thursday. And that's a huge problem because that is connected to Project Warp Speed, as the vaccines that were developed during COVID all used mRNA vaccines. So this would be an interesting conundrum for President Trump to navigate when it comes to, whether he should go along with this, because it's highly inconsistent. One side, you're saying he deserves a Nobel for Project Warp Speed, which RFK Jr. himself agreed that he did. And that happened on Thursday as well. And on the other hand, you are pulling contracts away from mRNA vaccine development. So that's an inconsistency that many of the senators pointed out during the Senate hearing.
There has been widespread speculation among insiders that there's a loss of confidence in the leadership at HHS because of all of these recent changes. You're at the White House a lot, Swapna. What are you hearing here?
Officially from the White House sources, they are basically circling the wagon. They haven't really said anything about RFK Jr. or any kind of loss of confidence. But people are, observers, may not be in the White House, but in general are making comments such as, why has there been a delay in basically making the second Maha report public? So the second report was supposed to look at the strategies on how to deal with issues that the American public is dealing with as far as health. And although it has been submitted to the White House, they still have not made it public. And that's kind of raising some questions, on what's happening. And of course, RFK Jr. is supposed to be releasing a study on autism anytime soon, but, there's no word on that.
When the CDC was founded back in 1946, the big issue was mosquitoes and malaria. Then we had this once-in-a-lifetime pandemic in 2020, and that was COVID. Where is RFK Jr. putting the agency's focus now?
RFK really wants to put the focus on chronic diseases. And he says the numbers have skyrocketed over the last, 2 decades. And that's an area of focus that he feels CDC has not paid any attention to. And so he calls it, rather than healthcare, he says CDC has been involved in sick care. So only when somebody falls sick, the treatments that they have to go through, and that's the kind of research that the CDC is involved in, rather than preventative, on what kinds of foods to eat or what are the more nutritious foods that would prevent certain diseases. Those are, recommending physical, exercise and things like that, which he has all recommended in the very first Maha report that he put out back in May, and over medicalization. These are things that he's mentioned in the first report, and his focus fully seems to be on chronic diseases, and he's always talking about that.
Swapna, thank you for being on The Excerpt.
Thank you, Dana. Thank you for having me.
Thanks for watching. I'm Dana Taylor. I'll see you next time.